CDC is naming Andes virus now, and it says the U.S. risk is extremely low, with 41 Americans across 16 states being monitored and 0 confirmed cases. This is Hantavirus Watch. Today, we're closing the loop on treatment, on what CDC's Travelers Health page now actually says, and on what 41 monitored contacts and 0 U.S. positives really means as a baseline.
I want to know whether that 0 is based on real PCR draws or just 41 people who haven't gotten sick yet, because Canada named a province and a lab process, and the U.S. still hasn't told us which.
Yeah, that's the gap. And we're going to fill it in, plus the straight answer on treatment that anyone exposed deserves. CDC writes,
CDC is currently responding to the outbreak of Andes virus, a type of Hantavirus, among passengers and crew of a cruise ship which had been sailing in the Atlantic Ocean. The overall risk to the American public and travelers for Andes virus infection is extremely low. Routine travel can continue as normal.
CDC's Travelers Health page is now saying Andes virus by name and calling the overall risk to the American public extremely low. That's the clearest public-facing risk call they've made, and it sits right next to 41 people monitored across 16 states and 0 confirmed U.S. cases.
I'll take CDC's extremely low-risk language, but put it next to the other facts today. There's no proven specific antiviral for Andes hantavirus. CARE is ICU supportive, and WHO is reporting 3 deaths out of 10 confirmed cases. That's a 30% case fatality number sitting under a "continue travel as normal" headline.
Those don't conflict. Extremely low risk is the population statement. 30% CFR is what happens if you're one of the cases. Right now, the surveillance baseline is 41 monitored, 0 U.S. confirmed. If that number changes before the 6-week incubation window closes, we'll see it change.
Canada ran the PCR, named the province, named the process. PHAC confirmed a BC resident through provincial lab testing on May 17. The U.S. has 41 people across 16 states, and the public answer is still just monitored. Which of those 16 states have actually drawn blood, and which are just waiting on symptoms to show up?
Virginia Department of Health writes,
The current outbreak is caused by a type of hantavirus called Andes virus. Andes virus is unique. It is the only hantavirus that has been shown to spread from person to person. This spread between people is rare and has only been shown to occur after people start showing symptoms. Signs and symptoms of hantavirus pulmonary syndrome, HPS, due to Andes virus appear 4 to 42 days after exposure.
Virginia Department of Health is now running its own Andes virus page, and that's actually useful. It spells out that person-to-person spread has only been documented after symptom onset, not during the incubation window. That's the transmission clarification that's been buried in WHO fine print all week, now on a state health page for Virginia residents.
VDH says very low risk and routine travel as planned. Fine, that's a population statement. But Virginia is one of those 16 states with monitored contacts. I want to know whether any of those monitored Virginians have had blood drawn, or whether they're just refreshing a symptom checklist every morning.
That's the live gap. VDH points to WHO for the case counts, and CDC has 41 monitored across 16 states with 0 confirmed U.S. cases. But nowhere in this week's official guidance is monitored publicly defined as tested. And that distinction matters a lot more now than it did Monday. People with Vanessa Etienne.
Health officials said they are monitoring 41 people across 16 states who may have been exposed to the virus, including 18 who are quarantined in Omaha and Atlanta. Among those being monitored are the passengers who returned home from the MV Hondius cruise ship before the outbreak was identified.
CDC Incident Manager David Fitter confirmed on Thursday, after a new round of testing at Nebraska Medical Center, that there are 0 known U.S. cases. So, 41 people monitored across 16 states, 18 of them quarantined in Omaha and Atlanta, and the number that matters right now is still 0 confirmed.
That Nebraska testing round is the part I want pressed on. Canada drew blood on the BC resident and got a PCR result. Are those 41 people across 16 states getting the same? Or is 0 confirmed really just 0 symptomatic so far, with a bunch of untested contacts sitting behind it?
WHO gives us the stakes denominator. 10 confirmed Andes cases, 3 deaths. That's a 30% case fatality rate on the confirmed count. And the treatment answer is still ICU supportive, nothing targeted. So the monitoring protocol for those 41 people is not a formality.
CDC's own Travelers Health page calls the risk to the American public extremely low. Fine, that's a population statement. But if you're the specific person in one of those 16 states who was on the Hondius and is now staying home voluntarily, extremely low and no proven antiviral are two very different sentences. If someone who was on the Hondius starts showing symptoms, what can doctors actually do? Is there a real treatment for Andes Hantavirus? Or are patients basically on their own once they're in the ICU?
The honest answer is that there's no proven specific treatment for Hantavirus, and that includes the Andes strain. Per the American Lung Association, care is almost entirely supportive. ICU teams are trying to keep the patient alive while the immune system fights back. So intubation and oxygen, fluid replacement, and medications to hold blood pressure stable. Ribavirin has been tried, and doctors may use it in very severe cases, but as the American Lung Association notes, no large clinical trials have actually proven it works against Hantavirus. The MSD manual adds that the disease follows a recognizable pattern: sudden fever, headache, and muscle aches first, then a quick escalation to cough and serious breathing problems. That's why early recognition matters so much. The window between the flu-like early symptoms and the severe pulmonary phase can be very short, so getting a patient into an ICU before respiratory failure sets in is probably the most important treatment decision available right now. And the CDC's interim guidance, published May 10th specifically for Andes virus exposure, is aimed at helping clinicians and public health officials assess and manage people who may have been on that ship. Basically, the scaffolding around that catch it early imperative.
So if ribavirin isn't proven to work, why are doctors still reaching for it at all? Is this basically a "we don't have anything else" situation?
Pretty much, yes. In a disease with a high case fatality rate and no approved alternative, severe cases create pressure to try anything with a plausible mechanism, even without definitive trial data behind it. What matters going forward is whether this cluster produces enough cases under controlled clinical observation to actually add to the evidence base. The 2018 Epuen outbreak in Argentina, which also involved Andes virus and person-to-person spread, was intensively studied at a virological level. So clusters like this one do eventually feed back into research. And if you or someone you know was aboard the Hondius and develops any fever or respiratory symptoms, the guidance is clear. Contact a clinician or your local health department right away and mention the potential exposure. Do not wait to see if it passes. If you've got feedback, a story idea, or a correction for us, send a note anytime to hantaviruswatch@lanternpodcasts.com. We read what comes in, and it helps make the briefing sharper. If you want to dig deeper into anything we covered today, you'll find links to every story in the show notes. Follow the ones that caught your attention whenever you have a moment. That's Hantavirus Watch for this Tuesday, May 19th. This is a Lantern podcast.